If you are suffering from pain and are prepared to return to an active lifestyle, Orthopaedic Medical Group of Tampa Bay can help. With how? I'm glad that Dr. Mark Sando, medical doctor of sports medicine and general orthopedic surgery, is with us now. Welcome. How you doing this morning?
Doing very well. Thanks for having me.
So tell us a little bit about the group before we dive in, because I love a good show and tell, and I feel like we are going to get a great explanation of how you're able to help patients.
Yes. So Orthopaedic Medical Group of Tampa Bay, we have 9 offices across the area, from St. Pete on the west to Winter Haven on the east, all the way north of Wesley Chapel down to Sun City, with central locations in Tampa, Brandon, and Plant City. We have almost 14 medical providers in the office and multiple PAs and athletic trainers to help see and treat patients.
And when it comes to treatment, we are talking about orthobiologics.
Yes.
What is this umbrella? What is this scope of medicine? And how, of course, does this relate to helping patients?
Yes, so orthobiologics is an area of orthopedics where we are taking something from the patient, a biologic from the patient.
Okay.
Whether it's peripheral blood, bone marrow, or you can even do fat aspiration from the patients. And we're using that to treat a variety of musculoskeletal conditions, from tendon injuries, ligament injuries, arthritis, and it helps to reduce pain, reduce inflammation, and increase tissue healing, promote regeneration, and decrease degenerative processes within tissue over time.
So give people an idea. This in front of me is actually like blood that would be drawn, right?
Correct.
Walk me through how this process works so we actually get to see it.
Yeah, so this is something that can be done in the office in a non-invasive, non-surgical way. It can also be done as an adjunct to surgical repairs or surgery augmentations. But this example that we have here on the table is peripheral blood, platelet-rich plasma. PRP, otherwise you'll hear of it.
I've heard of that, yeah, okay.
Yeah. And so what happens in the office, if you were going to undergo this procedure, is you would have peripheral blood drawn, about 60 cc's, which is represented by this vial here. That's then spun down in a centrifuge for about 8 to 12 minutes, depending on the volume and the viscosity of the blood. And it separates the layers of the blood out. And so we get the plasma layer on the top here, and we're trying to get rid of most of the red blood cells on the bottom there. That is then processed on this benchtop delivery process here, and we aspirate off the platelet-rich plasma layer, this plasma on the top, and then we try to get this little white section, we call that the buffy coat. And
that's where I actually see that. Yep. Wow, okay.
So it layers it out very nicely like this, and then using this thing here, we can put a syringe on top and dial in the concentration that we want. We can get multiple syringes of different concentrations of tissue when we're treating different problems. So for example, this first one here is more of a leukocyte-rich, platelet-rich plasma that's used to help treat tendon injuries, tendinopathies, partial tendon tears. This one is more of a leukocyte poor, which is more of just this yellow plasma here.
Yeah.
That's used more for arthritis type conditions. There's also another feature that we can use in this specific system. There's several systems that can be used for it. This is the one that I like the most. And this is called a protein concentrator, and we can run the extra plasma through that. It dehydrates it to capture more growth factors and different molecules that help with reducing inflammation, and that's really good for helping to treat patients with arthritis.
I got to tell you, just being able to see this, my light bulb has come on, because we've heard about this medical treatment. We've heard that this is the way you're going to help patients. I want to ask, before we run out of time, who's a good patient? When is the right time to reach out to your team?
Sure. So anyone who's been dealing with pain in a joint for a long time, if they've had an injury, if they have a partial tendon tear, those are things that can be treated very effectively with platelet-rich plasma in the office. People who have had arthritis in joints for a long time, whether it's the hip, the knee, the shoulder, and who have failed other treatments, steroid injections, physical therapy, bracing, things like that, these are all adjuncts to the treatment. Those may be a good candidate for PRP injections. Steroid injections can help for short periods of time with pain reduction, but PRP, the studies are all showing it lasts for a lot longer. So coupling that with a good exercise program, a good diet, good physical therapy, it's a combined approach, right? This isn't a magic cure-all, but it definitely helps as a tool in our armamentarium to help patients with pain relief for longer and help them stay out of surgery for longer too.
Well, you know what? There's the website right there. Doctor, thank you for your time and explaining this today.
Thank you so much.